Unfortunately, cancers like esophageal cancers are increasing due in part due to the obesity epidemic. The patients who are at highest risk for esophageal adenocarcinoma are obese white men who reflux or have a history of reflux. Chronic reflux leads to a condition called Barrett's esophagus. Barrett's esophagus is the precursor condition to esophageal cancer. If you have Barrett's, the Barrett's then can change to what we call low-grade dysplasia, then high-grade dysplasia, then eventually cancer. It's a continuum. Barrett's is completely preventable by controlling the factors that cause acid reflux. Things that you can do to decrease risk of Barrett's esophagus and esophageal cancer: number one, maintain an ideal body weight, that is, don't be obese. Belly fat seems to produce chemicals that increase the risk of cancer. Number two, decreasing behaviors that increase acid reflux. For instance, eating certain types of food, drinking, smoking, all increase the risk of acid reflux. Number three, there's some good evidence that eating a whole food plant-based diet may also decrease cancer risk independently. If you have a family history of Barrett's, you're at higher risk for bad things happening, like developing esophageal cancer. Therefore, you should be more aggressively screened. The good news is that if we find any precancerous changes in the esophagus, there are lots of techniques that can be used to reverse the Barrett's into normal lining again.
Since my father's passing, I've heard of friends, family, countless individuals, and they've experienced symptoms just like my father, day in and day out. It's difficult to convey in words what losing a parent is like. Talk to your primary care physician. Don't wait. If you're scared, do it for your family. If you don't have family, do it for Jeff. Do it for my dad.
If you have the symptoms we have described, please take the opportunity to talk with a primary care physician.
We have great teams of experts that are very committed to preventing esophageal cancer and treating Barrett's esophagus.